Hi, I'm Dr. Neneman with Neneman Chiropractic Clinic, and thanks for joining us again in another week in our video blog series. You probably just saw the animated bumper at the beginning of the video there. I just want to send a big thanks to Noah Witchell with Noah Witchell Video and Motion Graphics. He designed that bumper for me, and it's going to play at the beginning of all of our videos now. So he did a great job, and we're pretty happy with it. I think it's a pretty cool little animated clip there. So thanks to Noah. But today, what I want to talk about is actually the spine and vertebral anatomy. I've been talking a lot about the shoulder, the knee. I actually want to focus in on the spine, which is actually the core of what we do as chiropractors. So many people have misconceptions about what's really hurting in their back. I can't, and I did a blog on this once, but I have so many people that come in saying, I think I just pulled my muscle. Well, as I always say, that spinal muscle attaches to the spine, so you can't injure one issue without injuring the other. So if you did pull a muscle, it's probably going to affect the biomechanics of the spine, and vice versa. If your spine is not biomechanically functioning properly, it's not moving properly, it's misaligned, it's likely to cause injury or tension to the muscle. So, but so many people think they're probably just muscular when it's definitely coming from the spine. A lot of people, they always just assume when their back hurts that they have an injured disc, but the pain is oftentimes not coming from from a disc problem. It's coming from elsewhere in the vertebra. So today I'm going to go over a little bit of anatomy of the vertebra, and I don't expect you to be a anatomy expert after watching this, but I just want you to have a better idea of where your pain could be coming from. All right. So here we are looking at 3 lumbar vertebrae, which are vertebrae in the lower back. To orient you here, this is the front of the spine, this is the back of the spine here. So most often patients come in thinking they automatically have a disc problem. Here are the discs, it's the padded cartilage in between the vertebra. Now I will say that disc problems are a common issue. Most people actually have some disc bulging whether they know it or not. It's often said, a good percentage of people walking around on the street with no pain actually have bulging discs and they don't know it. Because a lot of times bulging discs don't cause pain. Other times they can cause a lot of pain. So I just want to let you know it does happen, but so many other times the pain that you're having in your back is coming from another structure. So here's the front of the spine. Again, there's the vertebra, disc, vertebra, disc, vertebra. Okay, now we go. This little space where these are the nerves that come out here. If you look kind of from this angle, on the left and right side of your spine, behind the disc and vertebra here, you have spinal nerves that come directly off the spinal cord. Here's the spinal cord here. But yeah, on the inside, nerves come off the spinal cord there, and they go to organs, muscles, etc. But the little space where the nerve comes out is called the intervertebral foramen. This is can be a common source of pain. Degeneration or arthritis, just common misalignment, fixation of the vertebra, inflammation can all put pressure on this nerve. So a lot of times, you may not even have a disc bulge, but just with due to inflammation and misalignment, you could have some pressure being put down on this nerve, or there's a lot of bone spur buildup, osteophyte buildup from degeneration that can put pressure on the nerve there as well. So that could be a source of pain. Now, if you do have a bulging disc, that disc it's usually always going to bulge backwards or sideways. So commonly, when it does bulge, it'll bulge and hit that nerve and can cause pain as well. Now, another source of pain, which is very common, is facet joint pain. Now, you might ask, what is a facet joint? On the back of the spine here, where these two vertebrae come together, you can see there's a joint right there. That's the right facet joint. You come to the left side, there's the left facet joint. You come down a level, there's the left facet joint here, there's the right facet joint there. That's where these bones come together in the back. You can see here when you move, bend forward, backward, you can see motion at that joint. There's a joint capsule in there. this could become very inflamed. So this is a common area that people injure in their back, is they actually injure these joints. The joint gets inflamed, it hurts. Commonly this is a source of back pain, very common. So, and then as I mentioned before, another source of back pain is the muscle, because the muscle comes up and attaches directly to the spine. So again, usually if there's going to be muscle involvement, there's spine involvement, and vice versa. So as you can see here, there's several different sources of pain. Whether it be caused from disc bulge, nerve compression, facet joint pain, muscle pain. A lot of times more than one of those is involved at the same time. That's basic anatomy of the vertebra and the joints and surrounding area of the disc. Gives you a little bit better idea of how the spine functions, what could be going on with it. Join us again next time for another great video blog. Have a great 4th of July. Be safe.